Have you ever felt embarrassed to talk about issues related to the anus? Maybe you have felt discomfort after sitting for too long, or noticed blood on the toilet paper after a bowel movement, but you didn't tell anyone because you were ashamed. If that sounds familiar, you are not alone. It is estimated that up to half of all adults in the United States, over the age of 50, have experienced hemorrhoids at least once in their lives. This is a very common health condition, but it is also one of the most overlooked and rarely discussed topics in everyday conversations. In today's video, we will explore everything you need to know about hemorrhoids, from causes, symptoms, and the different stages to treatment and prevention. But first, let's take a few minutes to talk about why this topic matters so much. Because too many people are suffering in silence, without realizing that there are simple, effective solutions that can completely change the quality of their lives. Let me introduce you to Mark, 58 years old, from Austin, Texas. Mark is a calm man, works as an engineer, and spends most of his day sitting in front of a computer. For many years, he frequently experienced constipation, but always thought it was normal due to a low-fiber diet. Recently, Mark started to feel pain and itching around his anus, and worse, he noticed bright red blood appearing after bowel movements. Although very worried, Mark hesitated to see a doctor because he felt embarrassed and did not want to talk about it with anyone, not even his wife. It was only when the burning sensation became unbearable that Mark decided to see a doctor. The result? He was diagnosed with grade 3 hemorrhoids, meaning the hemorrhoid had prolapsed and could not retract on its own. If Mark had gone to the doctor earlier, the treatment would have been much simpler and far less invasive. Mark's story is not uncommon. In fact, there are millions of Americans just like him silently suffering from hemorrhoids due to a lack of knowledge, embarrassment, and the belief that this is just a normal part of aging. What about you? Have you ever experienced symptoms? Like Mark, have you ever felt uncomfortable after sitting too long, or had to strain hard every time you had a bowel movement? Leave a comment below to share your experience. Don't be shy, because sharing can help others feel less alone and give them the motivation to learn how to take care of their health the right way. The next section, we will learn exactly what hemorrhoids are, the common types, and the different stages of the condition. Don't miss it, because understanding things correctly from the start is the first step toward getting out of pain without having to suffer any longer. It is time for us to take a clear and scientific look at hemorrhoids, because in order to treat it effectively, you need to understand the nature of the problem correctly. Hemorrhoids are essentially the excessive dilation of the veins in the anus and lower rectum. When these veins become swollen, they form hemorrhoidal lumps that cause burning, pain, bleeding, or prolapse. However, not everyone knows that there are different types of hemorrhoids, and each type has its own symptoms and treatment approaches. Hemorrhoids are divided into 3 main types: internal hemorrhoids, external hemorrhoids, and mixed hemorrhoids. Internal hemorrhoids form inside the anal canal. Because they are located internally, patients often do not feel them at first. The initial sign is usually bright red bleeding after a bowel movement. As the condition worsens, the hemorrhoids may prolapse outside. External hemorrhoids, on the other hand, form around the outer rim of the anus and can be easily seen or felt. Patients often experience pain, burning, or itching even without having a bowel movement. The third type is mixed hemorrhoids, meaning a person has both internal and external hemorrhoids at the same time, which causes more discomfort and is often more difficult to treat. For internal hemorrhoids specifically, doctors classify them into 4 grades to assess the severity of the condition. Grade 1, internal hemorrhoids are the earliest stage, when the hemorrhoid is only slightly swollen and has not prolapsed. The stage may only present with light bleeding and is often overlooked by patients. Grade 2 occurs when the hemorrhoid begins to prolapse during straining. It retracts on its own afterward. Grade 3 is when the hemorrhoid prolapses during straining and cannot retract on its own, but must be manually pushed back in. Finally, grade 4 is the most severe stage, where the hemorrhoid prolapses frequently, causes constant pain, and carries a risk of infection or tissue death if not treated promptly. Which grade are you in? Or have you never checked your condition? Share that in the comments. The more people openly share, the more useful information there will be to help the community understand and deal with the issue earlier. I want you to meet Linda, 62 years old, living in Phoenix, Arizona. Linda frequently experienced bleeding after bowel movements, but always thought it was just due to chronic constipation. Since there was no pain, she ignored the symptom for over a year. Only when the hemorrhoid prolapsed and caused constant burning did Linda go to see a doctor and discovered that she was in grade 3. Linda shared that what she regretted the most was not learning about the condition sooner, because if she had treated it in the early stage, she could have completely avoided medical intervention. One of the most common misunderstandings is thinking that just sitting on the toilet for a long time will cause hemorrhoids. This is only partially true. Sitting on the toilet for a long time can increase pressure on the anal veins, but the main factors are still prolonged constipation, a low-fiber diet, lack of physical activity, or being overweight. Therefore, it is important that you take a comprehensive look at your lifestyle rather than focusing on a single behavior. In the next section, we will dive deeper into the signs and symptoms of hemorrhoids, including early warning signs that are very easy to overlook. Stay tuned, because this could be the information that helps you detect the condition before it progresses to a more serious stage. Let's talk about a topic that is often overlooked but extremely important: the early signs and symptoms of hemorrhoids. You may have experienced a slight itch around your anus and thought it was just due to an allergy or hot weather. But did you know that could actually be one of the very first signs of hemorrhoids? A man named Thomas, 52 years old, living in Texas, once shared that he started feeling anal itching about 3 months before he went to see a doctor. At first, he thought it was just related to his diet or hygiene, but then he noticed bright red blood on the toilet paper after every bowel movement. That is a classic symptom. If you have ever experienced something similar, do not take it lightly. Also, do you often feel discomfort or pain when sitting for a long time? That can also be an early sign of hemorrhoids. Such symptoms are often ignored or mistaken for muscle fatigue or the effects of prolonged sitting, but in reality, it is your body trying to speak up. Please pay attention, because when hemorrhoids progress, the signs become much clearer and far more uncomfortable. One major warning symptom is when a hemorrhoidal lump protrudes outside the anus. This means the internal hemorrhoid has slipped out of the anal canal and may no longer retract on its own. Many Americans, like Linda, a 60-year-old teacher in Florida, described the persistent burning pain during bowel movements as so intense that they avoid eating normally, just to reduce the number of times they have to go to the bathroom. Besides burning pain, if you notice swelling, redness, or any discharge of pus around the anus, that could be a sign of infection. Inflammation in the hemorrhoidal area can lead to serious complications if left untreated, including anal abscesses or even sepsis. So, when should you see a doctor? The answer is, as soon as you notice blood after a bowel movement, or if you feel ongoing pain, or if you detect an unusual lump around your anus. You do not need to wait until the symptoms become severe. Early detection not only makes treatment easier, but also helps avoid more dangerous complications in the future. Have you ever experienced any of the signs we just mentioned? Please share your story in the comments below, because your experience may help others recognize their condition earlier, too. When it comes to hemorrhoids, many people tend to focus only on the external symptoms, such as bleeding or burning pain, but few truly understand the deeper causes behind the condition. Understanding these root causes is the key to effective prevention, especially in a modern lifestyle full of hidden risks. Have you ever asked yourself, why do I have hemorrhoids even though I am not pregnant or elderly? The answer lies in the very habits we often think are harmless. The first and most common cause is chronic constipation. When your stool is hard and difficult to pass, you are forced to strain. This action increases pressure on the anal veins, and over time leads to the formation of hemorrhoidal tissue. Similarly, people who have the habit of sitting on the toilet for a long time reading or using their phone are unknowingly causing blood to pool in the anal area, leading to vein dilation. Imagine an office worker named David who sits in front of a computer for more than 8 hours a day and frequently suffers from constipation due to irregular eating habits. After a few months, he begins to feel itchiness around the anus and sometimes notices bright red blood on the toilet paper. These were the first signs David ignored. In addition to mechanical causes, an unhealthy lifestyle is another major contributor that cannot be overlooked. A low-fiber diet, meaning a lack of vegetables, fruits, and whole grains, slows down the digestive process. If you do not drink enough water each day, your body will not have enough moisture to soften the stool, increasing the risk of constipation and hemorrhoids. Obesity is also a significant risk factor. Excess body weight puts pressure on the lower abdominal organs, including the anal veins. People who work in low-mobility environments, such as drivers, accountants, or office workers who sit for extended periods, are also at higher risk. For our American audience, does that sound familiar? A long workday, a quick hamburger meal, rarely drinking plain water, but often choosing carbonated drinks, and then sitting still for hours without moving. These seemingly small habits, accumulated day by day, create the perfect environment for hemorrhoids to develop. If you recognize any of these patterns in your own life, now is the perfect time to make a change. Are you experiencing one of these causes? Please share in the comments below. Recognizing the signs early and making lifestyle adjustments not only helps prevent hemorrhoids, but also improves your overall digestive health. Treating hemorrhoids is a personal journey, and there is no single method that works for everyone. However, one thing is certain: if you clearly understand the available options from natural remedies to modern medical treatments, you will have a much better chance of managing the condition safely, effectively, and long-term. So, if you or someone you care about is dealing with burning pain or discomfort during bowel movements, stay with us until the end of the section. We will help you identify the solution that suits you best. First, let's talk about how to relieve pain and inflammation right at home. One of the simplest methods that many patients find soothing is a warm sitz bath. You only need to sit in a basin of warm water for about 10 to 15 minutes, 2 to 3 times a day, especially after a bowel movement. The warm water helps soothe the anal area, reduce swelling, and relax the muscles. In addition, pure coconut oil is also favored by many people thanks to its natural anti-inflammatory properties. You can apply a thin layer to the affected area after cleaning thoroughly. Some patients report that they feel relief after just a few days of consistent use. Alongside that, over-the-counter creams, also known as OTC ointments containing hydrocortisone or astringents, also help reduce itching and burning in the early stages. But you should be aware, if you use steroid-based creams for more than a week without improvement, you should stop and seek advice from a medical professional. Next, diet plays an extremely important role. Did you know that a lack of fiber is one of the reasons hemorrhoids worsen over time? Take a moment to review your weekly meals. Are there enough leafy greens, whole grains, and fresh fruits? Consuming between 25 and 30 grams of fiber each day not only helps soften stools, but also reduces the need for straining during bowel movements, a key factor in placing pressure on hemorrhoidal veins. Additionally, remember to drink enough water, at least 1 large thermos, which equals about 1.5 to 2 liters of water daily. A woman we once interviewed, Maria, 62 years old, shared that simply maintaining a breakfast with oatmeal and fruit, combined with walking about 30 minutes a day, helped her symptoms nearly disappear after 3 months. But what happens if natural methods are not enough? When should you consider medical treatment? The answer is, when you experience frequent bleeding, prolonged pain, a prolapsed hemorrhoid that cannot be pushed back in, or if home remedies are not effective after several weeks. One common option is rubber band ligation. A doctor uses a small tool to place a rubber band around the base of the hemorrhoid. After a few days, the hemorrhoid tissue dies and falls off. The advantage of this procedure is that it's quick, relatively painless, and does not require a long recovery. However, it is only suitable for internal hemorrhoids at mild to moderate stages. If you are concerned about invasiveness, the laser method is also considered a modern, less damaging option. By using laser energy to shrink the hemorrhoid and reduce blood flow to the area. This procedure often requires no stitches and causes less post-procedure pain. However, the cost may be high, and not every facility is equipped with this technology. Finally, there is hemorrhoidectomy, a surgical option for severe, mixed, or complicated hemorrhoids. This method is highly effective, but also carries risks, such as post-operative pain, long recovery time, and potential complications like anal stricture or incontinence if not done correctly. Therefore, if you are unsure about which option to choose, have a thorough discussion with a colorectal specialist for a full evaluation. There is one important point to emphasize: every body is different. Not everyone needs medical intervention, and not everyone can be treated with home remedies. What you need is patience, accurate knowledge, and close monitoring of your body's changes. Leave a comment if you would like to know more about exercises that support pelvic circulation or need detailed guidance on a diet for people currently treating hemorrhoids. We are always here, ready to accompany and support you on your journey to natural and effective healthcare. Now that we've explored treatment options, let's talk about something just as important: how to prevent hemorrhoids from coming back and how to live comfortably if you've had them. Many people feel anxious after recovery, worried about flare-ups or uncomfortable bowel movements. But the truth is, with the right habits, you can take control and live without fear. Let's start with something simple, but often overlooked: your bathroom posture. Yes, how you sit can make a big difference. In the United States, we usually use a standard sitting toilet, but that posture can make bowel movements harder and strain your rectum. Here's a better way: use a small footstool to elevate your feet. When sitting on the toilet, this mimics a squatting position, which naturally aligns your colon and makes it easier to pass stool. You might have heard of the squatty potty. It's not just a gimmick, it's based on real science. Now, let me ask you, how often do you rush through meals or skip vegetables? Diet is a major player in preventing recurrence. Take John, a 62-year-old retired teacher from Ohio. After a painful bout with hemorrhoids, his doctor advised him to increase his fiber intake. John started each morning with a bowl of oatmeal topped with blueberries and flaxseed. Lunch was a salad with leafy greens, chickpeas, and olive oil. Dinner, grilled salmon, steamed broccoli, and a side of brown rice. By sticking to this high-fiber plan and drinking plenty of water, about 8 cups a day, John not only felt better, but hasn't had a flare-up in over 2 years. But what if you have a desk job or tend to sit for long periods? That's another risk factor. Every hour, stand up and move around for at least 5 minutes. Even simple stretches at your desk or walking to get a glass of water can improve blood flow and reduce pressure on the rectal veins. And don't underestimate the power of daily exercise. You don't need to run marathons. Try 20 to 30 minutes of brisk walking, gentle yoga, or swimming. These movements support healthy digestion and help you avoid constipation, a key trigger for hemorrhoids. Before we wrap up, I want to leave you with a sample one-day fiber-rich meal plan that's friendly for those with hemorrhoids. Breakfast: warm oatmeal with chia seeds, half a banana, and unsweetened almond milk. Lunch: whole grain sandwich with turkey, lettuce, tomatoes, and avocado. Add a side of apple slices with peanut butter. Dinner: lentil soup, a baked sweet potato, and sauteed spinach with garlic. Snack ideas: a handful of almonds, dried apricots, or carrot sticks with hummus. If you've struggled with hemorrhoids before, tell me in the comments what daily habit made the biggest difference for you. Or, if you're just starting to make changes, which of these tips will you try first? Let's share and support each other. You don't have to live in fear of flare-ups. With small but steady changes, you can reclaim comfort, dignity, and peace of mind. We hope this video has helped you better understand hemorrhoids, from causes and symptoms to treatment and how to prevent recurrence. But the most important thing is action from you. If you're facing uncomfortable symptoms, don't suffer in silence. Start with small changes today to regain comfort in your life. What stage of hemorrhoids are you at? Stage 1, 2, or maybe something more severe? Leave a comment below. We're always here to listen and provide further guidance. And if you found this video helpful, Please share it with family or friends who may be silently suffering and unsure where to start. Sometimes, a video like this can truly change someone's life. Don't forget to like, subscribe, and turn on the notification bell so you won't miss out on our weekly, simple yet practical health tips. Thank you for watching until the end. See you again in our next health topic.